Good day everyone. Today we will be talking about dengue fever. Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas in the world. Mild dengue fever causes a high fever and flu-like symptoms. The severe form of dengue fever, also called dengue hemorrhagic fever, can cause serious bleeding, a sudden drop in blood pressure, and death. Millions of cases of dengue infection occur worldwide each year. Dengue fever is most common in Southeast Asia, the Western Pacific Island, Latin America, and Africa. But the disease has been spreading to new areas, including local breakouts in Europe and southern parts of the United States. Researchers are working on the dengue fever is common. The best way to prevent infection are to avoid being bitten by a mosquito and to take steps to reduce the mosquito population. Many people experience no signs or symptoms of dengue infection, but when symptoms do appear, they may be mistaken for other illnesses, such as the flu, and usually begin 4 to 10 days after are bitten by an infected mosquito. Dengue fever causes a high fever of about 40 degrees Celsius and any of the following signs and symptoms, such as headache, muscle, bone, or joint pains, nausea, vomiting, pain behind the eyes, swollen glands, and a rash. Most people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. This is called severe dengue hemorrhagic fever, or dengue shock syndrome. Severe dengue happens when your blood vessels become damaged and leaky, and the number of clot-forming cells, which are your platelets, in your bloodstream drops too. This can lead to shock, internal bleeding, organ failure, and even death. Warning signs of severe dengue fever can develop quickly. The warning signs usually begin the first or 2 days after your fever goes away and may include severe stomach pain, persistent vomiting, bleeding from your gums or nose, blood in your urine, stools or vomit, bleeding under the skin which might look like bruising, difficult or rapid breathing, fatigue, irritability, or cirrhosis. Severe dengue fever is a life-threatening medical emergency. Seek immediate medical attention if you've recently visited an area in which dengue fever is known to occur and you've had a fever and developed any of the warning signs. If you've been traveling recently and developed a fever and mild symptoms of dengue fever, call your doctor. Dengue fever is caused by any of the 4 types of dengue viruses. You can't get dengue fever from an infected person, however, you can get it through the spread of mosquito bites. The 2 types of mosquitoes that most often spread the dengue viruses are common both in and around human lodgings. When a mosquito bites a person infected with dengue, the virus will then enter that mosquito. Then, when that mosquito bites an unaffected person, the virus will then enter that person's bloodstream and cause an infection. After you've recovered from dengue fever, you have long-term immunity to the type of virus that infected you, but not from the other 3 dengue fever virus types. This means you can be infected again in the future by one of the other 3 virus types. Your risk of developing severe dengue increases if you get dengue for a second, third, or fourth time. You have a greater risk of developing dengue fever or a more severe form of the disease if you live or travel in tropical areas. Being in tropical and subtropical areas increases your exposure to the virus that causes dengue fever, especially high-risk areas include Southeast Asia, the Western Pacific Islands, Latin America, and Africa. The second factor is if you've had the dengue fever in the past. Previous infection with a dengue fever virus increases your risk of getting severe symptoms if you get it once again. Here are several ways to prevent from getting dengue fever. First is the vaccines. In areas of the world where dengue fever is common, one dengue fever vaccine, known as Dengue is approved for those ages 9 to 45 who have already had dengue fever at least once. The vaccine is given in 3 doses over the course of 12 months or 1 year. The vaccine is approved only for people who have documented history of dengue fever, or who have had previous infection with any of the viruses. For people who haven't been infected in the past, receiving the vaccine appears to increase the risk of severe dengue fever and hospitalization when infected in the future. The second way to prevent dengue is to prevent mosquito bites. The World Health Organization, or WHO, stresses that the vaccine is not an effective tool on its own to prevent dengue fever, where the illness is common. Preventing mosquito bites and controlling the mosquito population are still the main methods for preventing the spread of the virus. Here are some tips that can help reduce the risk of mosquito bites. 1. Stay in air-conditioned or well-screened housing. 2. Wear protective clothing. 3. Use mosquito clothing. 4. Use mosquito repellent. And 5. Reduce mosquito bites. And that is all. I hope you learned something new today. Thank you for watching.